The number of cases is increasing, and so is the number of deaths. The international community is on high alert because today the World Health Organization held an emergency meeting about the coronavirus. The members of the WHO's emergency committee were split on whether to declare this a pandemic. So they postponed a decision on that until tomorrow. They'll convene again tomorrow. Ground zero is the city of Wuhan in China. Most of the infections have originated there, but some cases have emerged in neighboring countries, including one case all the way in the United States. More than 540 cases of the illness are now confirmed, and the death toll for the coronavirus has reached 17. As of today, Wuhan is essentially under quarantine. Officials there have closed all of its transportation networks and told citizens not to leave the city. Here at home, governments at all levels say there's no reason for alarm as there have been no confirmed cases. The risk is still assessed at low, but they are preparing for the worst.
I want all Ontarians to know that their health and well-being is my top priority. While the risk proposed by the new coronavirus to Ontarians remains low, the province is actively monitoring and is ready to respond.
The spread of the coronavirus has sparked fears of a SARS repeat, a global outbreak that left 774 people dead back in 2002 and 2003, including 44 Canadians. So how are governments preparing this time around? Dr. David Williams is Ontario's Chief Medical Officer. He joins us now from Queen's Park. Hi, Dr. Williams. Thanks for making time for us.
Good afternoon, Vashi.
Doctor, let me start off with something we just heard out of Quebec, which is the medical officer there saying that they're investigating 6 cases. Can you bring us up to date on the situation in Ontario? Are there any cases under investigation as we speak?
Yes, we've had cases even before today that we have been following. We call them persons under investigation. And so far we've had 4. In that, we've looked at those and ruled those out as being novel coronavirus. So those processes are already in place. We have our laboratory testing methodologies there and methods of submitting samples and testing to see, as we found in some cases, it wasn't novel coronavirus, it was influenza A, because this is influenza season. We have lots of influenza A and B and other respiratory viruses circulating. So you want to rule out novel corona or rule in the other ones in that process. So we are undertaking that. There are ones that are occurring, and we'll probably have more as the days go on, which is what we want from a responsive system, and people coming forward to give us the right information and voluntarily submitting to be assessed.
So just so that I'm clear, you have 4 that were under investigation and you've concluded that they don't have the virus, and then there are other cases that are currently under investigation and have not yet been ruled out. How many of those are there?
I haven't got those numbers right now. I can think of 1 or 2 others, but there's others that are coming in because our health system, including our primary care physicians and hospitals, are all on the high alert. They're looking for these cases, and as you've heard from our system here, we have moved it to be in a reportable disease. And so we have our legislation in place that allows those to be moved quickly to our public health departments that can do then contact tracing and other advice and counseling, as well as requiring physicians and other healthcare providers to report to the local medical officer of health that can enter the information material in. So our whole system of monitoring and surveillance is ramping up, which includes a lot of investigation of people that may have suspect they have some unwellness, they may have had a travel history. We do our case definition around that, consistent with our other PT partners and with the federal government and hopefully with WHO and CDC. So we're undertaking that process now, and that whole surveillance methodology that we've built out through the knowledge of SARS and other ones like Ebola and MERS-CoV is up and running, and everybody is prepared to monitor and take part.
Doctor, when you say ramping up, can you explain clearly in layman's terms what exactly you mean? What is different today than yesterday?
Well, yesterday they were doing it on a voluntary basis. They were calling us up because they thought we should know. We were appraised of those situations. Now with reportability, and what that does is 2 things. One, it sets up a system and protocols in place that do with data collection and accuracy and all the compilation and analytics. But more importantly, it allows healthcare providers, that means physicians, hospitals, other institutions, labs, etc., if they suspect or have a case that they're working up, they're required by the law to report to the public health system. And so therefore, it allows them to share personal health information from their offices to the medical officer of health, who's also a health information custodian, respecting privacy and monitoring that. So that system now is legally up and running. And so that is the ramping up of that, which equips the field and the sector with more ability and powers to undertake the surveillance capacity.
Given what you know so far about the spread of the virus, how likely do you think that there will be a case in Canada?
I think it's probably likely because with the amount of travel, where we don't have any direct flights to Canada from Wuhan, and now with the limitations that the Chinese government put in place, nevertheless, like in Toronto, we have daily somewhere between 1,500 to 4,000 people arriving from China all over different parts. So we have a lot of people coming in. The Chinese New Year is coming up, a lot more movement and travel, and people could have been in Wuhan and traveled in directly from other cities that came into Toronto. And we have a large community, so it wouldn't be surprising to me that we would get positive cases. They may be very mild, and we think that people who had some concerns, we would want them to come forward and saying, I have a travel history, it's positive the last 14 days, I was in Wuhan, I'm feeling a bit unwell, and they'll come forward and get assessed, because this is not a punitive thing, this is when we're having to say collaboration. They would like to know if they have a problem, we would like to know, and they'd like to know if their family and members need to have extra protection, yes or no. So all this is part of a collaborative process.
Dr. Williams, does the system in Ontario have the resources and the capacity to deal with this? I would note CBC's reporting earlier today that many of Ontario's biggest hospitals were filled beyond 100% capacity nearly every day in the first half of this year. If there is to be, and I'm not trying to spread any kind of fear here, the risk is low, but if anything does escalate, does the system have the capacity to deal with it?
Well, as I said, the first response is to deal with the people who are mobile, who are coming in and getting assessed. And that means then by doing this very proactively in the past, when we had SARS, it started in the hospital. We didn't even know what the organism was. We didn't know that it was there. We didn't get any heads up. We're getting much more forthright communication from the Chinese officials and through WHO and CDC. And that's a big change. We actually know the organism now. We have the gene sequencing. We have laboratory testing. So by doing that more proactively with people that are out there, by doing isolation, by doing contact tracing, we hope that we can prevent people from getting into the hospital, but those are really sick that need to be seen.
But what about once they get in the hospital with respect, Dr. Williams? What about that?
Well, then they have all the policy and procedures in place that we put in through SARS with our Provincial Infectious Disease Advisory Committee, with infection prevention control policies and procedures, so they know how to isolate the patient, protect the staff, protect the other patients, so it will not be spread within the hospital. That's the key thing.
Even if it's beyond 100% capacity?
If it's 100% capacity, because you still have your isolation rooms, you have to have negative pressure ventilation rooms. And when that starts to happen, we have what I said we have in Ontario, we have a Health Service Emergency Measures branch. And it also activates a medical emergency operations center that coordinates and deals with these patient issues if and when they do occur, including supply matters, material matters. So we have a very much iterative process where all the stakeholders are involved. And excuse me, when those issues arise, we will deal with those and move with patients and deal with capacity issues as needed.
Okay, I'll leave it there. Thanks very much for your time this evening, Dr. Williams.
Thank you, Vashi. You're welcome.
David Williams, Ontario's Chief Medical Officer of Health. So what exactly is the coronavirus and how fast is it spreading at this point? Here's what we know. The coronavirus is a cousin of SARS, otherwise known as severe acute respiratory syndrome. In 2002 and 2003, an outbreak of SARS infected more than 8,000 people. 774 died globally, including 44 people here in Canada. The coronavirus, like SARS, originated in China. The first cases are linked to a seafood market in the city of Wuhan. Scientists say it likely started in an animal and spread to humans. This strain can cause fever, respiratory complaints, and could lead to more severe symptoms like pneumonia. So far, the coronavirus has infected more than 500 and killed 17. Most of those cases are in China, but the virus has begun to spread to Hong Kong, Taiwan, Japan, Thailand, South Korea, and the United States. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.